Prevalent from chronic hepatitis E virus infection in transplant recipients, immunotherapy in renal cell carcinoma. Definition: Hepatitis E is a virus that infects your liver. It can cause your liver to swell up. Most people with hepatitis E get better within a few months. Usually, it doesn't lead to long-term illness or liver damage like some other forms of hepatitis do. Renal cell carcinoma (RCC) is also called hypernephroma, renal adenocarcinoma, or renal or kidney cancer. It is the most common kind of kidney cancer found in adults.
The following is a CT scan of the abdomen and pelvis performed with intravenous contrast. We'll start at the lung bases and scroll inferiorly. As you scroll inferiorly, we can see that there is an exophytic, predominantly solid mass arising from the upper pole of the left kidney, compatible with the renal cell neoplasm. There is an additional mass in the left kidney seen more inferiorly. However, if we observe its density value, and in fact measure its density value by putting a Hounsfield unit over this, we'll see that it measures simple fluid, somewhere between -20 and 20 Hounsfield units, thus indicating that it reflects a simple cyst. As we scroll through the right kidney, we can see that in the interpolar to lower pole region, there's another simple cyst. However, there are no solid masses arising from the right kidney to suggest a renal neoplasm. On these images,
Hepatitis E is RNA virus. Spread by the fecal-oral route. Incubation period 3 to 8 weeks. Common in Central and Southeast Asia, North and West Africa, and in Mexico. Causes a similar disease to hepatitis A, but carries a significant mortality, about 20% during pregnancy. In general, hepatitis E is a self-limiting viral infection followed by recovery. Prolonged viremia or fecal shedding are unusual. In acute infection, IgM antibodies to hepatitis E virus are positive. Does not usually cause chronic disease. A vaccine is currently in development, but is not yet in widespread use. Thank you for watching. For more videos,
Application in medicine. Hepatitis E is a liver infection caused by the hepatitis E virus. It is found in the stool of the infected person. It is spread when someone unknowingly injects the virus, even in the microscopic amounts. In developing countries, people most often get hepatitis E from drinking water contaminated by feces from people who are infected with the virus. RCC, renal cell carcinoma, occurs when cancer cells start growing uncontrollably in the lining of the tubule of the kidney. Fast-growing cancer often spreads of the lung and surrounding organs. Etiology: the hepatitis E virus spread through poo. You can catch if you drink or eat something that has been in contact with the stool of someone who has the virus. RCC. Medical experts don't know the exact cause of RCC. Some factor of family history or RCC, dialysis treatment, hypertension, obesity, smoke, cigarettes.
Hepatitis E virus, referred to as HEV, is a common cause of sporadic and epidemic acute liver disease in developing countries. In the United States, sporadic cases of both imported and locally acquired HEV infections are mostly seen among adults. Incubation ranges from 15 to 60 days following exposure, with an average of 40 days. Liver enzyme elevation, as shown in blue and labeled ALT for alanine aminotransferase, usually occurs 4 to 5 weeks after exposure to HEV and persists for 3 to 13 weeks. Symptoms noted by the purple bar occur when liver enzymes are elevated. Virus excretion in stool, illustrated by the orange bar, is variable, but usually lasts from about 1 week before symptoms appear until
Renal cell carcinoma is the most common type of kidney cancer in adults. It accounts for approximately 3% of adult cancers, and the incidence has risen steadily by about 2 to 4% each year in the past few decades. It is effectively a collection of different types of tumors, each derived from the various parts of the kidney cell and displaying salient genetic characteristics, histological features, and, to some extent, clinical picture. When it metastasizes, it has the tendency to spread to the lymph nodes, lungs, liver, adrenal glands, brain, or bones. While the exact cause of renal cell carcinoma is unknown, there are risk factors that increase the chance of developing it, such as smoking, high blood pressure, family history of kidney cancer, and obesity.
I think the most interesting data and the one that people are very excited about is the Emotion 151 that we just heard from Dr. Bob Moser. And this is a phase 3 randomized trial that looks at bevacizumab with atezolizumab versus sunitinib in a phase 3 setting for advanced metastatic clear cell kidney cancer. So let me just give you a little background on how we treat kidney cancers or advanced kidney cancers. So certainly there has been a lot of landscape changes. In the past, if we go back even a decade ago, we really did not have a lot of systemic therapies to offer. But now we have VEGF inhibitors. So these are what we call the TKIs.
Symptoms. Hepatitis E, they may start anywhere from 2 to 6 weeks after the infection. They may include mild fever, feeling very tired, less hunger, feeling sick to your stomach. Renal cell carcinoma, a lump on side belly or lower back, gluten-free, low back pain, and on side losing weight and not feeling hungry. Symptoms. Treatments. Ribavirin for chronic hepatitis E virus infection in transplant recipients. All the patients have HEV viremia when ribavirin was initiated at the end of therapy. HEV clearance was observed in 95% of the patients. Occurrence of HEV replication occurred in 10 patients after ribavirin was stopped, and sudden viral response definition as an undetectable serum HEV RNE level of the least of the 6 months after sessions of the ribavirin therapy occurred in 46 of the 59 patients, 78%.
So in moving forward, clearly, almost for the last decade, we've successfully, as Danny pointed out, extended progression-free survival, more than doubled, sometimes tripled overall survival. It's been an absolutely dramatic time for most kidney cancer patients. But having said that, where we've fallen short is that chronic therapy is required. Coming off therapy, disease progresses. Oral agents are still associated with significant, potentially life-changing side effects that change how people do. And we need to be looking for new approaches. And at this past ASCO and
Pro and cons. Hepatitis E anemia was the main indirect side effect of regard of the reduction of ribavirin dose in 29% of the patients. RCC, with an increased number of the treatment options available, improved biomarkers are needed to better satisfy patient and define of the optional selection of the patient and the sequence of the treatment to overcome resistance. Issue applied in Ecuador. Ecuador is not an endemic country for hepatitis, as in the case with Peru and Brazil. However, even though the national rate is less than 8%, it is believed that the people who could be suffer from hepatitis, but they don't have never been diagnosed due to not having found timely medical attention. RCC remains one of the most common tumors worldwide, causing more than 140 deaths on the worldwide, and renal cell carcinoma accounts for 90% of the cases. Conclusion: hepatitis E, ribavirin, and monotherapy may be effective in the treatment of the chronic HEV infection, and 3 months course seems to be appropriate duration of therapy in the most patients. RCC therapeutic options for patients with RCC have expanded greatly over the past decade, with the targeted immunotherapy being the new